Hi, I'm Jennifer Wild, and you're listening to Sober Exposure. If it's about recovery, we're gonna cover it. It's like one big therapy session, but it's free. So thanks for joining our dysfunctional family as we uncover recovery with Sober Exposure. Let's go. Hi, it is Sober Exposure. We have another edition. Another week, another doctor. Again, you know, I don't know if you noticed, but I've been on a roll. I've been interviewing all types of different doctors because, last season we were just talking to, the regs, the norms. Well, nobody's actually normal, but this season seems to be all the pros. So all of my episodes that have to do with ADHD, I am fielding questions. People call, they reach out to me for months afterwards. It is such a hot topic. And I met Dr. J because we were dealing with my ADHD. And then we realized that we have so much in common as far as mental health advocacy and where he is. There's just so much to talk to about you. So I had to have you on and welcome to the show. Thank you so much for coming on.
The pleasure's all mine, Jen. Thank you for having me.
So let's start with, okay, you're a doctor. What kind of doctor are you? Everyone's a doctor now, right? I used to work with a DJ. They called themselves Dr. I don't want to say her name because I want to insult her. But, she'd go on the air like she's a doctor. I mean, she's a doctorate in like political science. Meanwhile, she's talking about, medicine. So anyway, tell us.
Gotcha. Well, so as you already know, Jen, I'm a psychiatrist and I have a specialty in child psychiatry. So went to the University of Florida for my adult psychiatry training and then went to UF again also for the child psychiatry fellowship.
What is it that attracted you to, I mean, it's hard enough to try and get through adults' heads, but trying to get through a young child's head? Are you kidding? Were you not? Well, like what attracted you to working with obviously I'm kidding is so important, but just curious.
No, I mean, it's a really good question, Jen. In fact, like when I got into the field, I didn't even think I'd be doing child psychiatry, to be honest with you. For me, it was an extra 2 years technically, but fortunately I had a fast track where I was only able to complete the whole training program within 5 years. Otherwise it would have been 6 years. So there was definitely some hesitancy in going into it, but after finishing child fellowship and after practicing for some time now, no regrets. I'm so happy to be working with kids and adults, and I see the whole age range from young kids to really elderly adults.
Okay, so you do everything, but you do have a little specialty with the children, which, I mean, we have so many moms and dads and grandparents and even older siblings that have children in their lives.
Yep.
And I have a few questions and I want to see where you stand with this.
Of course.
So kids are often diagnosed with ADHD.
Mm-hmm.
So what is the difference between being diagnosed with ADHD and just being maybe an undisciplined kid? Okay, I'm going to give you a couple. So there's that. So how do we know? We'll start with that because it feels like everybody, I had a girl on here about a year ago in this way. I said to her, I was like, everybody's ADHD, everybody's kids ADHD, it's overdiagnosed. And as a matter of fact, these soccer moms, they want their kids to have the diagnosis because then they can get the extra help.
Gotcha.
So then when you really do have a child that's suffering with this debilitating disorder, so it's so overdiagnosed. This girl freaked out. She was like, how could you say that? It's not diagnosed enough. There's not enough awareness. I'm like, listen, I feel like I do raise awareness, but I also feel like whatever. Anyway, that was my question.
Fantastic question. And it's obviously the overdiagnostic part, that's not good. But at the same time, there's a lot of underdiagnoses as well, right? A lot of kids who have been struggling with ADHD for so long, they don't get diagnosed until a decade, 2 decades later. And
or
so
misplaced diagnosis too, which we talked about. Okay.
Oh yeah, absolutely. So what it usually comes down to, this is what I tell all my patients, it all goes back to the individual. Like what is the individual experiencing, and how much impairment in functioning, how much reduction in quality of life is actually being experienced by the individual. And ultimately, this is where we have to come in as psychiatrists to kind of figure out what that threshold is for ADHD versus no, it's not ADHD. And there's some scales and tools that we use to help us with that. One example is the Vanderbilt rating scale. Another one is the SNAP 4 rating scale. But ultimately, what it comes down to, and a lot of people are kind of shocked when I say this, it's a clinical diagnosis. I mean, it's something that we have to talk about in our history, as I take the history from the patient, talk about their past.
So you can't just do the test. I can't just do the test, and however the test comes out, the diagnosis, you have to really do spend some time with the patient. That's what you're saying.
Yep. You got it. There's even like some computerized testing platforms that we can use to help with the diagnosis of it. But even then, even if it's a positive result, at the end of the day, it's still up to the clinician to be able to diagnose the disorder. And the reason I like that, I actually like that a lot, because I mean, at the end of the day, one thing that I love to talk about too, Jen, is this is the brain we're dealing with. This is the mind. It's a very vast, complex thing. It's not as simple as the other organ systems in our body, right? One of my old supervisors used to tell me, and I love this analogy. It describes this so perfectly. The heart, it's kind of like Kenya, right? The lungs, it's kind of like Canada. The brain, the mind, it's the deep blue sea.
Yeah, right. Just right. And no idea what's going on there. Yeah.
And honestly, it's so much of it is yet to be explored, but we do know some things, right? And that's why it comes down to the clinical interview and making sure that we get the history and all the different components, family's input, mom and dad's input, brother's input, and ultimately, and especially the patient's input.
Like this is where also the misdiagnosis comes a lot, especially with kids too, because maybe it's something else, maybe it isn't, maybe it's like, okay, so this is, I'm just going to say it, the big pink elephant and the word. I know that ADHD and bipolar disorder can look very similar. So how do you decipher between the two? Because I know they're treated differently, correct?
Yeah. Oh, absolutely. And it's also a fabulous question. So when it comes to bipolar disorder and ADHD, bipolar disorder, it's characterized by something we call either a hypomanic episode or a manic episode. Hypomanic episodes are 4 or more days of a couple of different symptoms. And it's usually quite pronounced compared to your normal daily routine, daily baseline. And that's why I think there's unfortunately too many misdiagnoses of bipolar disorder. A lot of times the history isn't really kind of pinpointed in terms of, okay, how many days has this episode been going on, and what kind of behaviors are we seeing? A lot of times are reckless behaviors. A lot of times they're grandiose type behaviors. What's interesting about ADHD is that there's no particular distinct period of time where that episode happens. ADHD is an everyday condition, something that you deal with constantly.
So if you're like on the high upswing of your bipolar disorder every day, then you're more likely to be ADHD.
Yeah,
if it's consistent every single day.
And there's even a little bit of fine tuning even there too, Jen, because there's some disorders in the bipolar spectrum, like mixed state bipolar. Some people can be in a very hyper state for a longer period of time. So it can be kind of ultimately it comes down to the interview.
It's not cookie cutter.
The history. It's not cookie cutter, and that's honestly why I love psychiatry. That's why I'm so passionate about it. It's
really cool. That's why I love it too, because one size does not fit all, exactly. and that's the reason why, this podcast is so interesting, because someone's listening, they're being like, oh, you think, Jen, do you? But is because there's so many facets. We started doing sober exposure to talk about recovery from alcoholism and addiction, but so much of it, turned into talking about the brain and all of the disorders. Like, okay, here's one, which came first? Because we do have a lot of addicts listening. So it's also like, which came first, the chicken or the egg? Because I'm all of it. So I have ADHD, and I was also diagnosed. I was also an addict at a very young age.
Yeah.
And the reason why I started using substances so early was because I was self-medicating. I was self-medicating my ADHD.
Gotcha. Gotcha. And unfortunately, that's the case for a lot of people, Jen. And not gonna lie to you, I have ADHD too, and then I think that's what really kind of propelled me into this profession. It's like when you struggle with it, right? It's a whole nother story because especially when you don't get treatment, and that's another thing I wanted to kind of mention too.
Yeah, we have to talk about that. But I got to point this out, how amazing it is that you're saying here that you struggled and suffered with ADHD. And what I want to say is, if you're the parents, a mother like me, of someone else with a child with ADHD, it just
Yeah.
shows you can still do it. You can push through. You went through medical school with ADHD. Seriously, how the hell did you manage to do that? Because you were so focused, right, on just that.
Jen, I still have no idea. and in fact, I really wish I got diagnosed so many years ago, because if I did, life would have been so much easier.
Wow.
No.
Wow. So, yeah. So when were you diagnosed?
So I was actually, no joke, I was actually diagnosed in my second year of fellowship, and it's so sad because I was again working with all these people with ADHD, and here I was just trying to like get everything organized, trying to get everything like done on time.
You're like,
And
wait a minute, I have this shit.
exactly,
What am I?
exactly. And so when I finally, and what's so funny about ADHD, John? This is one of the other things I've kind of seen. Isn't it so interesting how a lot of mental health disorders, they kind of basically they kind of feed on itself, right? So for example, the ADHD, one of the common symptoms is forgetfulness, or
Okay.
a lot of procrastination, not able to follow through on tasks in a timely fashion. And so if that's the symptom of the diagnosis, right? What if one of the tasks was to get a psychiatric evaluation, right? What if one of the tasks was to actually get help for your ADHD? Ironically, or I guess not, like it kind of feeds on itself, right? Like, so the disorganization, the procrastination leads to the person further getting behind, and then do they ever get to that appointment? Do they ever get to the
They don't get diagnosed. Years and years and years.
exactly,
You just
exactly.
described my brother. And
Okay.
like seriously, yeah, God love him, but he has such debilitating mental illness.
Oh my
Why am
gosh.
I'm like whispering, like you didn't, like you can't rewind it. Mental illness, so
Yeah.
debilitating
Yeah.
that it's like, he's like, you don't understand. I just can't even get to the appointment. There's no
Yeah.
way. It's like,
Exactly,
yeah,
exactly.
yeah.
It's incredible how the illness itself can jeopardize your ability to get better, and that's like one of the most frustrating yet very true things about mental health. Depression is another great example, right?
Yeah,
So,
and addiction. Yeah, but go
okay,
ahead. Keep going with the
addictions.
depression. Go with the
Oh,
depression first. Go
and,
ahead.
and addiction as well. Great example. Depression, here we are with this condition that causes low energy. You don't have any motivation. You don't want to get out of bed. You can't get out of bed. Your brain just won't let you, right? And what's wild about that is, well, if you can't get out of bed, if you can't do the things that you need to do in life, what else is going to happen? You might miss some bills. You might get into financial stress. You might get into job stress. You might get into family stress, right? And what does that do? It's going to make your depression worse. And it's just the cycle that feeds on itself. And it's so sad, right? And that's the truth for so many other mental illnesses, like you said, addiction, right? And a lot of times, and this is kind of going back to your prior question, Jen, when
Mm,
it comes to chicken or the egg, right? What came first? What's interesting is, so ADHD, the data on it, if you
mm.
have untreated ADHD, you are twice as likely to develop a substance use disorder compared to the normal or average population, right?
Yeah.
And so what's so interesting is this kind of gets into this whole deep blue sea kind of thing again, right? It's incredible how ADHD is just part of the puzzle. Addiction, there's a neurocircuitry there that unfortunately influences people to drink or use whatever substance it is way more than they should, or than they obviously can tolerate.
Handle,
And
right. Yeah.
yeah, and it's a lot of times, like I see depression coincide with addiction. I see ADHD coincide with addiction, and you can kind of already see the puzzle gets really complex, right? It's not just
Yeah.
one or the other, and I think that's one thing that we have to work on as a psychiatric field, right? Like I think in this field especially, we have to be okay with the gray area, the gray spectrum of really what this is. It's the ocean that we're dealing with. It
Yeah.
can't be categorized. And so what I tell patients is, we don't want to think about it as either this or that or that. We want to think about it as that and that and that and many more. For instance,
That and that. So wait, I that might be worse. So wait, you have that and that and that
exactly.
instead of you have say the first one.
This or that or that.
Oh, you have this or I get it. Okay, I love it. That's so important. Yes. So right. Yeah. So I don't know. It could be bipolar. It could be depression. It could be this. It could be I don't know.
Could be all of the above, and maybe
Right.
some other things too. And so another good example of that is depression, right? So is it just the brain chemistry in our brain that causes our diagnosis of depression? I mean, a lot of people will easily tell you, right, that they can take all the antidepressants in the world and they can go through all these different treatments, but if they don't do therapy, they don't talk about some of the things that are bothering them in their life, it just doesn't help, right? Or
It's
it doesn't
not
help
gonna
as much.
It's still even some people that do the cognitive therapy with it still doesn't help. Which brings me to well, I'm like non-responsive to so much. I haven't really been responsive to much when it comes to my depression.
Yeah.
Ketamine therapy has helped me a lot. And
Awesome.
so ketamine therapy, and I know that ketamine therapy is offered where you are at Cornerstone, which also, okay, so we're going to talk about all this real quick. Not real quick, but so we have the ketamine therapy, we have Cornerstone, where you guys who found actually the founder of Cornerstone was trying to help people that have mental health issues and are broke like me. That's how I found you.
Aw. But that's a huge issue, John. I'm so glad you bring this up because that's one thing that we're really passionate about with Cornerstone. So Dr. Mark Edinson, he's the founder of Cornerstone Psychiatric Care, and we're primarily a ketamine infusion center. Our nurse practitioner Jessica Shepley, she's the president of the company. The two have been so helpful to the community of Palm Beach Gardens. I mean, and many, of the surrounding cities. People who've tried all these different treatments, all these different medicines, they finally can, finally get relief from their trauma, from their PTSD, from their depression. And the best part, so one thing that I've talked with Dr. Anderson about is, and something that he's very passionate about is how do we make this affordable? How do we actually, get this to the people that need it, right? But they can't afford it. And so we're one of the centers in Florida that has insurance that we can take in patients' insurance to kind of reduce the costs of the treatment.
Wow.
Otherwise, a lot
for
of
the ketamine, you're talking about for the ketamine therapy, right?
Yep, you got it. Yep.
Yeah, because it's out of pocket. No, you can't. TMS, it's getting better with the TMS with insurance. TMS is that other stuff I did TMS last year, and it's okay. It's also another great avenue for someone that's non-respondent to depression. For me, not it was okay, but insurance is lightening up on that. Is it because? Right. See, with the TMS. Now, do you think it's because ketamine is like a drug and it's still kind of frowned upon?
And yes and no. I mean, I think that, and so that's another thing that I'm glad we're talking about, Jen, the stigma, right? The stigma of mental health, but also the treatments for our mental health disorders, right? A great example is ADHD and stimulants, right? Stimulants have this really bad rep, but if used appropriately for the right condition, for the right person, it can be life-saving. I mean, just going back to the stats again, right? Substance use is twice as likely if you have ADHD that's untreated. So again, but then going back to the ketamine part of it, it has this negative reputation, right? Because of it being a street drug, but we're obviously not using it as a street drug. We're using it as a medicine. And that's another thing I love talking to patients about. Every medicine has the potential to be a poison, right? And the reason for that is because side effects or drug-drug interactions or whatnot, they can reduce or worsen your quality of life, right? That's not the thing that we want. If a medicine is helping more than it's hurting, then it's medicine. If it's hurting more than it's helping, it's poison.
I love that. That's beautiful. I and it's a great gauge because I come from a world where I was taught a certain way. So some of the things I'm doing in my life right now as an addict is frowned upon by many.
Okay. Okay.
choices I make, just certain medications that I believe
I see.
have helped me, cope, so I'm not on the street or I'm not dead, you know what I mean?
Yeah.
And they help me cope.
Yeah.
So there's some people in the recovery world that don't consider me sober. Do I look like I'm fucked up right now? Do I look like I mean, like,
And thank you so much for sharing that, Jen. And
yeah,
so, let me tell you this, right? So stigma, it's incredible how pervasive it is. There's even professionals in the medical community that still stigmatize mental illness, right? And it's just so sad because no one can deny this. The brain and the mind, it all comes from the same place, right? And the brain is just as much of an organ as anything else in our body. And so mental health, mental illness, honestly, sometimes I wish like even that phrase would kind of just not be used anymore. What if we just call it brain disease, right?
I
Why
like
can't we,
that. Yeah.
right? Why can't we just call it something like really literally what it is? And so the stigma, that's something that actually is another thing that kind of perpetuated me into being a psychiatrist. I'm not gonna lie to you, growing up Indian. So my parents are from India. There's not really a really good opinion of mental health in the Indian culture.
Yeah.
And
Strict. Yeah.
yeah,
Yeah.
yeah, yeah. And then also when I was struggling as a kid with ADHD, I also have OCD too. Struggle with OCD and
Mm-hmm.
ADHD. And it's another thing we can talk about later.
Yeah.
It's a
That'll
very
be
cool.
another episode. We'll have to
Yeah.
do another episode on that because we are
Oh,
running out. Yeah, can I tell you how quick these episodes go? Like we're almost out of time.
oh
But
well.
yeah, but so growing up in the culture that you grew up in, that definitely is not accepted.
Yeah. Oh, definitely not.
Yeah, right.
And because of that, and also too because of the lack of awareness, lack of knowledge. And again, I don't I used to when I was younger as a kid, I used to have a little bit of bitterness towards my parents because I was just like I wish I could just get help, right? I wish I could have gotten help so much
Sure.
sooner. But what's so interesting, Jen, the older I get, the more and more I realize like just how pervasive stigma is. And not just that, but stigma prevents the knowledge of awareness of mental health, right? It prevents
Right.
people from being able to actually learn about it too. And so to kind of tie it back to what you've been experiencing, like with addicts in the community, it's sad because you're working on yourself, you're getting better, you can see that you're not as you're not struggling as much as you used to,
Mm,
right? You're improving your life, you're moving in the right direction. That's at the end of the day, that's all we're trying to do. That's everybody's goal in life, just to be a better version of themselves as we keep
uh,
going and going.
right.
And so the stigmatization, it's something that resonates with me, and I'm just so sorry to hear that you're dealing with that too. And ultimately it comes back to, if a medicine is helping more than it's hurting, then it's a medicine.
That's what I'm going to name the episode, and that's what I think you need to call your book. Seriously, I mean that is like there's a couple phrases that have been coined on this podcast, and you've just coined one. Yes, that's amazing. I love it. It's so great, especially for an addict. You know what I mean? That it's
Oh,
just a great way to gauge. And I mean, I could talk to you forever. We didn't even get to half of what I wanted to get to.
oh,
Like,
that's okay.
I mean, we could talk about, I don't even want it because this would turn into a political thing anyway about healthcare and how hard it is and how tough it is to get kids into treatment. Dr. Jay's an advocate of all of that. He works very hard to help
Absolutely.
people to get the treatment that they need. So do
Yeah.
you do virtual stuff if someone's listening and if they're not in the Palm Beach area and
Oh,
they want
absolutely.
to, so how do we find you? Tell everyone how,
so
yeah.
so so I work with Cornerstone Psychiatric Care. I'm in the so I kind of run the outpatient side of things in that company.
Mm.
So if you go to the Cornerstone Psychiatric Care website, you'll easily be able to find me, and then our intake coordinator Rafi will be able to get you on the schedule, and then we can start helping you.
Love Rafi. Yeah. Yeah.
Yeah.
And if you're interested in ketamine therapy, that can only be done in office.
That's correct.
Yeah.
And a lot of times, patients who see me, I do therapy with them. I do medicine
Hmm.
management, and if they're still having trouble with their depression or whatever illness they're still struggling with, that can be helped with ketamine. A lot of times, we do refer them to Dr. Adolescent and Nurse Shepley, and that way, we can kind of focus on the thing that I always love to talk about, the deep blue sea. It's vast. We have
Yeah.
to look at all the the different ways that we can help this person. The brain's not so simple, right? And actually, that's another thing too. Like going back to depression, right? It's not just brain chemistry. It's your family, it's your relationships, it's your sleep, it's your appetite, it's your your hobbies, it's your job. It all of this stuff plays a role, and it gets endless and endless, just like the ocean.
I love that analogy too. Such a powerful episode with so much information. And I hope to have you back before the end of the year, really, because there's, I think we have a part 2 in us.
Oh,
I definitely think we have a part 2 in us.
I couldn't agree more. There's so much more I want to share with you, Jen. And I can't thank you enough for, inviting me on, and it's such a pleasure to be here.
Awesome. Thank you so much. Dr. J, Cornerstone, me, Jennifer Wild, Sober Exposure. We'll have all the information if you want to reach Dr. J. Thank you so much again.
You're most welcome.
Need more? Of course you do. The show's all about needing more. Go to my website at soberexposure.show or get stuck on my Instagram at soberexposure_podcast.